Nurse practitioner Rosemary, what is syphilis?
So syphilis is caused by the bacterium Treponema pallidum, and it can be acquired through sexual relations. And you can also get it, a baby can get syphilis when mother is positive for syphilis during her pregnancy. So syphilis is very complex. So in fact, there's stages. So stage, you can have early syphilis or late syphilis. Early syphilis is comprised of primary, secondary, and tertiary latent syphilis. Those are pretty much systemic or skin symptoms. But the late syphilis could be latent syphilis or tertiary syphilis. So that can impact the organs. So it can impact your heart, central nervous system, as well as the skin and the bones. What I didn't say is that tertiary or late syphilis can come out 15-30 years after after exposure. You know what I mean?
So can it stay in the body with no symptoms for 15 to 30 years?
Yes.
And then what are some common symptoms of syphilis?
Common symptoms, well, it depends what stage you have of the diagnosis. So primary syphilis, you could start with a canker sore. So it's basically a lesion or an ulcer. It's usually painless. You can have it on the lips or a mucosa, it could be on the genitals, also the anal or perineum area. But for secondary syphilis, you can have a systemic rash. It could be on the trunk, so it could be on the front, on the back, palms of your hands, or soles of your feet.
How quickly does syphilis transition from primary syphilis to secondary?
It can be it could be months. It could be 3 weeks up to months, like 3 months, 6 months.
So what are the best ways to prevent syphilis then?
I think the best thing to do is know your body, know or be aware of signs and symptoms of syphilis. So for instance, if you do become intimate with somebody, I recommend that you be aware of any signs like lesions on the lips, or in the mouth or on the tongue, or on the genitals or in the perineum or anal. You want to avoid intimacy in those situations, or when a person has a rash. You don't want to be intimate until you know what the source of the rash is.
Where would that rash be at?
So the rash could be on the trunk, so the chest, the back, the palms of the hands or the soles of the feet. It could also be on the arms and the legs. The thing about syphilis, though, is that you could have a symptom and be unaware, and the symptom will go away without treatment, but the syphilis doesn't go away. You have to be treated for syphilis.
Is there anything that I can do if I am having sex with someone and I don't know if they have syphilis to protect myself?
Yes, so it's always recommended to use condoms, internal and external condoms, to avoid syphilis and any other ST.
What if am I safe from preventing myself from getting syphilis if I don't have penetrative sex? So if I don't have vaginal or anal sex?
No, actually, you're not protected because you can get syphilis through oral. So if a person receives or gives oral, you can actually acquire syphilis through the canker sore. That's when a person is most infectious. So if the person has like a sore under the tongue that is not visible, or mucosa not visible, or even in the anal area that's not visible, then yes, you can acquire syphilis orally without penetration through the genitals.
What about outer doors?
that would be considered part of outer course.
So outer course, rubbing genitals, but not actually.
So if you're intimate with outer course and there's no penetration, however, if you come in contact, all it takes is being in contact with the actual canker sore or the lesion or the ulcer. That's when if any part of your skin touches that lesion, so yes, outer course, it also you can also get or acquire syphilis through outer course just by touching.
Do any bodily fluids carry syphilis?
It's secretions, but it's because of the ulcer.
Okay.
Yeah.
And then, can I get tested for syphilis?
Yes. So syphilis, you can receive routine screening through your primary care or any testing facility. Yes. So you can do. Actually, there's rapid syphilis screening and also by drawing your blood.
How long does the rapid take versus the drawing blood?
So the rapid trichonema is 15 minutes, and of course, drawing your blood would be longer, like 7 days, 5 to 7 days.
Awesome. So I've heard there's something called neuro and ocular syphilis. What is that?
Well, neurosyphilis is when a person has secondary syphilis that has not been treated. It could impact the eyes and the ears, so it could impair your vision. For auditory, you could have like ringing in the ears or the hearing loss. And then, so that's what neurosyphilis is.
So that only happens in the second stage, or can it happen at any stage of syphilis?
Well, it can happen. It's part of the secondary syphilis, but it could transfer or transition into tertiary, where it's undiagnosed for years. But neurosyphilis is not something that you could be treated at a clinic. You need to have intravenous IV therapy, antibiotics, like in a hospital setting.
And then, can you tell me what the treatment for syphilis is?
Well, treatment consists of penicillin, also doxycycline if you're allergic to penicillin. But I would say to prevent syphilis, it would be best to recognize the signs of syphilis. So for instance, if you become intimate with your partner, you want to know if they have like ulcers or lesions on mouth or mucosa or the genitals, because you want to abstain from being intimate during this time. So even a rash, you want to wait until your partner gets tested or screened before they know.
For the penicillin and the doxycycline, are those shots or are they pills?
So the penicillin would be an injection, intramuscular injection. And then for the person who is allergic to penicillin, it would be doxycycline, which is oral pills.
Thank you so much, Rosemary. That was great.
You're welcome.
I'll give you a tipsy when you're done.
We'll take you to the Dollar Tree and we'll get you whatever you want.